Well, all throughout February, we've been bringing some great information for Heart Month from the folks from Secours Heart and Vascular Institute. Today, cardiac electrophysiologist Dr. Ryan Suter joins us to talk about what he does and how it keeps your heart healthy. Dr. Suter, welcome to the Hampton Roads Show. First of all, what is a cardiac electrophysiologist? Did I get it right?
Yeah, you're saying it right. It is a little bit of a mouthful, though.
Yeah, it's a tough one. What is it exactly?
One thing, it's not a movie star. You know, that's what I kind of wanted to be when I grew up.
Well, you know, I mean, he has his job and you have yours, and yours is saving lives, which is very impressive.
Well, a cardiac electrophysiologist is basically a cardiologist who specializes in heart rhythms of the heart. Believe it or not, the heart, you know, is more than just a big muscle that pumps the blood through your body. It's actually an intricate set of connections between the top and lower chambers, and I specialize in treating all aspects of rhythms, which can be anything from, you know, palpitation to cardiac arrest.
Dr. Suter, when you talk about rhythms, you're also talking about arrhythmia. What is that exactly?
So arrhythmia is just a very generic term for any sort of short circuit inside the heart. And like I said before, there's a complex set of connections within the heart. And you can be born with a short circuit in the heart. You can acquire them as secondary to certain types of heart disease, whether you've had a heart attack, a weakened heart from congestive heart failure, and other types of illnesses. So.
And how do you treat arrhythmias?
So there's a wide range of treatments available today. You know, 10, 20 years ago, we were very restricted in options. But there are medications, you know, that can be used to treat certain types of heart arrhythmias. But a lot of the things that I do specialize in things like pacemakers, defibrillators, different types of electrical devices that actually go inside and near the heart to help regulate the heart. Another thing that I do is something called an ablation procedure, which is a special type of surgery where I can take a catheter, which is sort of like a long fishing pole, bring it up to the heart, and through special, almost like a GPS within the heart, I can map and localize exactly where there's a short circuit in the heart and actually zap and eliminate that particular short circuit. So it's a constantly changing field.
You get to make a big difference in a lot of people's lives, and you save so many lives on a regular basis. What kind of advice can you give people out there to stay heart healthy?
The most important thing is you probably to take care of yourself, make sure you maintain your weight, eat right, exercise so that you never actually have to see me. That's really the bottom line. Because when you see an electrophysiologist, it means you have a real problem with your heart, and just staying generally healthy is probably one way to stay as healthy as you can.
But if you do need help, Dr. Suter can definitely help you, and you can find it more at Cardiac Electrophysiology, Secours Heart and Vascular Institute. Give them a call at 889-CARE, or you can look it up online at bshr.com. Dr. Suter, thank you so much, and thank you so much for coming in on Heart Month.
Thank you for having me.